Given the severity and frequency of pressure ulcers, there is a critical need for early detection in patients wearing casts.
Pressure injuries happen when you have too much heat, pressure, and/or friction between the cast and the skin.
Pressure injuries often develop over bony areas of the body. In the case of short leg casts, they commonly occur at the metatarsals, malleoli, and calcaneus. Our project focuses on the back of the heel.
They're really horrible injuries because it can mean infection, it can lead to further skin breakdown, and in the worst case scenario, even an amputation, especially for patients who have no sensation, like a kid with spina bifida, or a diabetic who has really severe neuropathy in their foot.
Pressure ulcers affect millions of people each year. They commonly affect people with diabetes, and 1/5 to 1/3 of those people will develop a pressure ulcer at some point in their lifetime. 20% of people who develop a pressure ulcer will require amputation, and over half of diabetic people with pressure ulcers will die within 5 years of ulceration. The PressurePal device consists of two main components, an electronics box and a pressure sensor. It also includes a foam dressing and 3 heel pieces in different sizes, each designated to match the curvature of the patient's ankle. Using a flat pressure sensor on the curved heel surface required a heel piece to translate curved forces onto the flat sensor. When the doctor opens the box, all they have to do is plug the pressure sensor in, turn the device on, and apply as directed. The pressure data collected from the piezoresistive sensor is transmitted via Bluetooth to a mobile app and notifies the user to adjust the foot position when pressure has surpassed the ulcer formation threshold.
And PressurePal, in that sense, helps give them that digital guidance on the device they're already familiar with using. That can help educate patients about what positions to avoid that put them at a higher risk for a pressure injury. In that sense, by helping to educate patients and give them more guidance, then we can help them avoid the complication.
The home page displays the current pressure with the live updating zone wiper. The green zone is defined as less than 5 millimeters of mercury. The yellow zone is defined from 5 to 50 millimeters of mercury, and the red zone is defined as 50 millimeters of mercury and above. A log symptom button allows users to record symptoms to a local database for later review. The stethoscope button opens the doctor's view, showing max and average pressures over time.
I think that there is a little bit of a learning curve when it comes to applying PressurePal, but once you've had a few repetitions, it's actually quite straightforward to apply, and it doesn't add significant time to the casting process, maybe like 2 to 5 more minutes. I don't know if it's even so much a matter of patient compliance, it's a matter of patient education. Most of the time, people want to take good care of their bodies. They just don't know how to. And all they need is a little bit of help and a little bit of guidance. And I think PressurePal is great for that.